Karnamaya Mongar survived 20 years in a refugee camp in Nepal. She didn't last a single day in an American abortion clinic. This is Christina with the Sisyphean Journal, and today is November 20th. Something to keep in mind when you hear Karnamaya Mongar's story is that state officials knew how bad this abortion clinic was. They knew that a 21-year-old or 22-year-old young woman named Shamika Shaw had already died after a botched abortion there. They knew about the multiple hospitalizations with life-threatening injuries, third trimester abortions, untrained staff doping women within inches of their lives, flea-infested cats roaming around and crapping on the floor. They knew how bad it was. Everything that happened to Karnamaya Mongar was enabled by what it sounds like lizardmen conspiracy theory, but what can be called the deep state. It's people who get into positions in unelected roles, and they serve the interests of special interest groups, not the interests of the people. And this had all begun when Tom Ridge was elected governor and said that they were to stop inspecting abortion clinics unless there was a complaint. And of course, the abortion lobby's friends decided they weren't going to investigate even if there was a complaint. A pediatrician who had referred teenage girls to Gosnell and noticed that they were coming back with venereal diseases hand carried a letter to the health department, and they did nothing. That is how irresponsible the state officials were. So Karnamaya was 41 years old, and she had been chased out of Bhutan with her family over some ethnic cleansing thing. So she lived in a refugee camp in Nepal. She, her husband, their 3 children, and 1 grandchild finally made it to the United States on July 19, 2009 as part of a resettlement program. Karnamaya was more than 18 weeks pregnant when she went to a clinic in Virginia for an abortion. But the Virginia clinic and another in Washington, D.C. didn't do abortions that late in the pregnancy. Now, some news coverage tries to pretend that that's because abortions were not legal in those areas. That's not true. There are just limits that some clinics set. Some of them is because of the risks. They just don't want to risk a lawsuit. Some of them are that the staff, particularly the doctors, just can't stomach it. A lot of the doctors who do abortions don't mind doing the earlier suction abortions because they don't have to see the baby as they're dismembering it. It comes out through the suction tube and they can send it off to the POC room. Technically stands for products of conception, but abortion clinics have been known to jocularly refer to the POC room as pieces of children. And they can just let some other staff go through, make sure there's 2 arms, 2 legs, a head, a spine, and enough internal organs and placenta to look like they got everything. So these earlier abortions are much emotionally easier on the doctors. When it gets to the point where they're having to reach in with forceps and start pulling pieces off, they find that a lot harder to deal with. So some of them, they draw their line personally at that point. And those are the reasons. Potential liability and staff uncomfortable with the procedure are the reasons, not the law, that these clinics are not doing abortions at 18 weeks. So one of the clinics referred Karnamaya to Kermit Gosnell's Women's Medical Society in Philadelphia. They were just known for, they've got no gestational limit, you've got the cash, they'll do the abortion. So Karnamaya and her daughter went to the clinic on November 18, 2009. That afternoon, Latasha Lewis, who had completed a medical assistant course but had never been certified, conducted the clinic's version of a pre-examination, which was so scanty that it did not even involve weighing the patient. And falsified consent forms were added to Karnamaya's file. She did not speak English, and there is no evidence that a translator was provided in any way, shape, or form. And Karnamaya, as you can imagine, spending most of her life first in Bhutan and then in a refugee camp, was a tiny, tiny, tiny woman. And this clinic, they did not adjust these drugs for the weight of the patient. They would just administer and administer and administer. So Karnamaya arrived at the clinic on November 19th at about 2:30 for the abortion. She was accompanied by her daughter and her daughter's mother-in-law. So the front desk staffer, Tina Baldwin, gave Karnamaya her initial medication, Cytotec to soften the cervix and cause contractions, and Restoril, a drug that causes drowsiness. After giving Karnamaya the medicine, Baldwin told her to wait in the recovery room until the doctor arrived to perform the abortion. And the recovery room was filthy. Blood-stained recliners. The patients were required to strip from the waist down, and then they were wrapped in blankets. The staff made every effort to wash weekly. Not consistently washed weekly, but tried to wash weekly if they could get around to it. Linda Williams and Sherry West had no medical-related qualifications whatsoever. They medicated Karnamaya in the recovery room while she waited for Gosnell. Now remember, a doctor has not examined Karnamaya yet. She has not seen a nurse practitioner. She has not seen a registered nurse. She has not seen a physician's assistant. She's just seen Gosnell's, well, I trained them myself, staff. Now, Karnamaya's daughter told the grand jury that she waited with her mother in the recovery room for several hours. And during that time, between 3:30 and 8 p.m., Karnamaya was given 5 or 6 doses of oral medications and repeated injections into an IV line in her hand. And as was the case with all the patients in Gosnell's clinic, there was no equipment being used to monitor her vital signs. Now, Yashoda did not know what drugs her mother was given, but typically employees gave repeated injections of a concoction of sedative drugs that Gosnell referred to as a twilight dose. And each of these twilight doses would be repeated a number of times at the discretion of unlicensed workers. The twilight dose was 75 milligrams of Demerol, 12.5 milligrams of promethazine, and 7.5 milligrams of diazepam. And I am including the anesthesia chart that the staff used at the clinic. This chart was drawn up by a 15-year-old girl, Ashley Baldwin, after Gosnell trained her for about 15 or 20 minutes. He basically gave her a book, told her to read it, and then talked to her. Okay? The state knew that he had untrained staff administering these powerful drugs, and they did nothing. So, again, the standard procedure was for the untrained staff to give repeated doses of sedative and pain-killing drugs to the patients without any regard for the patient's size or weight whenever the staff just thought it was necessary. So if a woman started moaning, they'd assume she was in pain, they'd give her another dose. Karnamaya was only 4'11" and weighed 110 pounds. She would have been endangered by a single dose intended for an average-sized woman, much less the massive doses that she was being given. Now, a little bit before 8 p.m., Weston Williams sent Karnamaya's daughter to another waiting room, and she was left there with no idea what was happening to her mother until the ambulance arrived at 11 p.m. Now, Williams helped Karnamaya to the procedure room, put her on a table, and drugged her again, this time with the clinic's custom dose of 75 milligrams of Demerol, 12.5 milligrams of promethazine, and 10 milligrams of diazepam. Then they left her unattended with no monitoring equipment, alone in the procedure room. Now, Sherry West told the detectives that sometime after sedating Karnamaya, Williams came out of the procedure room yelling for help. West said that when she entered the procedure room, Gosnell was there trying to perform CPR, and Linda Williams summoned Eileen O'Neill, an unlicensed medical school graduate, from her second-floor office. O'Neill told the grand jury that she thought Karnamaya was already dead by the time she got to the procedure room, but she took over performing CPR because Gosnell wasn't doing it correctly. This is something we see again and again and again and again in these deaths. Nobody at the clinic knows how to perform CPR. But no big deal. We don't need any health and safety regulations, and we do have them. Let's not enforce them because we might have to close that clinic down, and that would be bad. Dead women, not bad. Closed clinic, horrible. So Gosnell left to retrieve the clinic's only crash cart, which is the emergency kit used to treat cardiac arrest. He had to go up to the third floor and get it. After he returned with the kit, he didn't use any of the drugs to try to save Karnamaya. Instead, he just looked through them and seemed pleased that they were up to date, seemed to be interested in keeping outsiders from finding out that the crash cart had been nowhere near the procedure room while patients were being sedated. And O'Neill testified that Gosnell told her not to administer Narcan, a drug that could have reversed the effects of the Demerol. She said that Gosnell told her it wouldn't work on Demerol. O'Neill also said that she tried to use the defibrillator, but the paddles did not work. And that's something we see again and again and again in abortion clinics. The emergency equipment does not work. So it was after 11 p.m., long after O'Neill had decided that Karnamaya was dead, and so she went back to her office. Linda Williams finally asked Ashley Baldwin to call 911. Ashley went into the procedure room and found Gosnell alone with his certainly dead-looking patient. He told Ashley to turn on the pulse oximeter, which they should have been using all along to monitor Karnamaya's pulse and blood oxygen. That's that little clip they put on your finger. And that surprised Ashley. Put the pulse oximeter on. They knew that it had been broken for months. They were dressing the scene, which is kind of pointless because the emergency workers are having to wade through cat crap to get to this room. They're not going to be particularly impressed with anything you do. So the emergency personnel arrived at 11:13. They found Karnamaya lifeless in the procedure room and Gosnell just standing there doing nothing. The paramedics intubated Karnamaya to give her oxygen, started an IV line to administer emergency medications, because for some reason the staff took out the existing IV line and didn't tell paramedics about all the drugs they'd administered. The medics were able to restore some weak heart activity, but getting Karnamaya to the ambulance was needlessly and dangerously time-consuming because the emergency exit was padlocked shut. And this clinic, it was not built as a medical facility. It was 3 buildings that Gosnell had bought that were adjacent to each other, and he just knocked out doors here and there. It was like a Skinner box. Good luck finding your way around it. The cops who later raided the clinic sometimes got lost in it. So Gosnell sent Ashley Baldwin to the front desk to look for the key, but she couldn't find it. Ashley told the grand jury that a firefighter eventually needed to cut the lock, but it took him 20 minutes because the lock was so old. Now, Karnamaya's daughter and friend ran outside crying and saw this happening. And then the responders had to waste even more time struggling to maneuver through those cramped hallways. And when the ambulance arrived at the hospital shortly after midnight, Karnamaya had no heartbeat, no blood pressure, no respiration. Now, after aggressive resuscitation efforts, doctors were able to restore a weak heartbeat, and Karnamaya was sent to the intensive care unit, and they just kept her on life support until her family members could make the trip from Virginia to say goodbye. She was pronounced dead at 6:15 p.m. on November 20th from a massive overdose of Demerol. And once again, the state was notified. They took no action. None. Zero. Zip. Zilch. So this idea that, oh, if we legalize abortion, then it'll be regulated and there won't be any quackery. The abortion rights organizations know that this is not true. After Karnamaya Mongar's death, for some reason, Kermit Gosnell decided that he was going to apply for membership in the National Abortion Federation. Now, he had been attending their meetings and seminars. You didn't have to be a member, you just needed to pay your fee. For some reason, he decided then that he wanted to be a member, and a site inspector from the National Abortion Federation came up, spent a couple days there, was appalled at the conditions, said that there was no corrective action plan that could make Gosnell's clinic good enough for the NAF sticker. And let me tell you, their bar is not that high. I have seen some disgusting clinics that were NAF members, dead cockroaches, ungrounded medical equipment, you name it. She didn't report anything to the state. I mean, we know in retrospect that wouldn't have done any good. The state wouldn't have done anything, but it says a lot that she didn't bother reporting it. And what's more, the NAF clinics did not stop referring to Gosnell, and a National Abortion Federation clinic where Gosnell worked one day a week in Delaware, they didn't throw him off the staff either. You need to wrap your head around how little the safe part of safe and legal actually means to the abortion lobby. They don't care. It's all about the abortion happening. They prefer that the woman survive it, but if she doesn't, that's just so much grist for the abortion mill.